On this episode of the Ask Mike Reinold Show, we talk about ACL reconstructions with lateral extra-articular tenodesis.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are here answering your questions. Anything you want to talk about, sports, physical therapy, performance, career advice, we're here for you. Head to mikereinold.com, click on that podcast link, and you can ask us a question. As long as you guys keep asking, we'll keep answering. And we're getting close to 10 years, by the way. Whoa. Do you guys know that? I have that form that goes through the questions, right? And I have every question that was ever submitted, right? And there's a lot, right? But I think the first ones were like in 2015. So that's kind of crazy. How about that? Nobody's even listening anymore, but we are enduring, right?
Exactly.
That's impressive. But anyway, I am joined here by Dan Pope, Dave Tilley, Kevin Coughlin, Anthony Vedetto, Lisa Lowe, and Lenny Macrina answering your question. Len, who do we have for our solo student today?
Normally have a cheat sheet because we have like 5 of them, but I don't. We have Gavin Harden from Wisconsin, the home of cheese curds and other stuff. But I just know cheese curds. Welcome, Gavin.
How do you feel about cheese curds, Gavin?
Love
Extra squeaky.
curds. Extra squeaky. So good.
Awesome. Gav, what do we have for a question today?
All right. So the first question we have, Joseph from Texas asks, I'm starting to see more patients from a surgeon near me that have an LET procedure in addition to their ACL reconstruction. I'm not 100% sure what that means. Questions for the group. What exactly is an LET? Why should someone need it? And how does that impact the rehabilitation?
Awesome. Great job, Gav. Welcome. First one. He's in. I think future episodes we're going to see that you just continue to grow. I think it's going to be great. I love it. But all right. LET with ACL reconstruction. So LET, lateral extra-articular tenodesis, right? That's what that means. You could argue it could be LEAT. Do you hyphenate the extra-articular? And then would you use that? Like, is extra-articular one word or is it hyphenated?
I think it's one word.
I think it's one word.
Okay. All right. My bad then. Sometimes I like to throw a hyphen in. That's just,
Google says that guy. I'm just that guy.
I don't know. I guess so. Because intra-articular, I wouldn't put one. Anyway, I feel like we're off topic. Let's get back on topic. All right. So what's an LET, right? Let's start with that because that was Joseph's first question is what is an LAT, a lateral extra-articular tenodesis? Len, is our resident knee, that's all you... I think that's all you know how to do at this point. Why don't you start with talking about what it is, and then we can talk a little bit about what that does. But what is an LET, and why would somebody get it?
Right. So an LET is basically using the IT band as a extra stabilizer of the knee. And so if you know the IT band comes down laterally, attaches to Gerdy's tubercle on the tibia, they leave the distal attachment attached. They take out like a middle portion. Picture like they just take this little like saw and just cut a little piece long enough to create like a ligament, but leave it attached proximally and distally. And it's just this flap that's coming from the distal attachment. And they move that to the lateral, basically femur. And it's trying to create more of a rotatory stabilizer for the knee, because the ALL, which is one of those newer, quote unquote, I'm quote unquoting, and for people just listening, newer ligaments that was like discovered or something like that, like a decade ago. That ligament has been shown to be a stabilizer. But from talking to surgeons, it's a tough thickening to identify when you're in the heat of battle, from what I understand. And so a lot of surgeons can either try to repair that, or they do this lateral extra-articular tenodesis, also known as a Lemaire's Tenodesis. I think he's like a French surgeon or something like that who came up with the procedure. And so it's again a rotatory stabilizer of the knee. Research has been done on it, and with a concomitant ACL reconstruction, and it's been shown to decrease the incidence of tears and re-tears in people. So I think it's more appropriate for the people that are higher risk, right? Your teenage female, maybe your teenage male who's got super laxity, a previous history of an ACL, things like that are the people that will get this procedure done. And it's a surgical decision. It's something that's probably made prior to surgery. It's not like they're in there, or maybe they're in there and they're doing like a pivot shift test and they see that the knee is still not stable and they've already agreed to potentially do this surgery prior to the surgery, where they'll add this on if the patella tendon graft or hamstring graft or quad tendon graft is not sufficient with the intra-articular or intraoperative pivot shift.
You know what, Len? I'm not gonna lie. That you far exceeded my expectations on that question. That was impressive, right? Did you just Google that this morning?
It's somewhere in this melon. The coffee's flowing, so apparently it pulled it out appropriately.
That's awesome. Kev, I know you're in, to use Lenny's term, you're in the heat of the battle right now. What do these people look like after surgery? Do they look any different to you? Like, what do you guys experience on some of these and how they present?
Yeah, I have one person on my caseload with it now, and just to kind of reinforce what Lenny said, it's someone who is in that younger, higher risk cohort. So like the younger adolescent female who's very hypermobile. Like on her non-operative side, she has about 10 degrees of hyperextension in her knee. So the surgeon that she went to, I think for this cohort, tends to just do this procedure all the time with his ACLs. And I would say, she had a hamstring graft. So I think with the LET, she had a little more anterior knee pain than I would traditionally see in just a hamstring graft. But otherwise, this doctor doesn't put extra restrictions on it in terms of range of motion or weight bearing or anything like that. So it does seem to be like a pretty traditional rehab. There's not a lot of big changes, at least early on. As we're getting a little further down the road, I think, some of the times that we see the IT band working a lot, which would be kind of motions that are resisting or controlling hip extension with the knee flexing. But traditional things that are challenging in ACL rehab are still challenging. And I wonder if it's a little bit because of the LET or just because it's challenging because it's post-op ACL. So, from my experience with the few that I've seen, it doesn't seem to impact it too much. The other cohort that I've seen it in, like Lenny mentioned, I think we co-treated a college baseball player last year, Lenny, that he re-tore hopping over the fence, the pitcher.
Yeah.
And that was a tough re-tear, but they did an LET on him as well. Do you remember, was that the same surgeon or is that someone different?
Different.
Yeah. So it does seem like the revision surgeries, they're doing it as well to try to prevent another one. So, but it doesn't seem like the rehab process is all that different.
Right. Makes sense. I mean, are there any differences in the rehab process?
I would say you're not going to see different precautions typically. I think you'll see a little bit more pain and swelling with these just because of the nature of taking down more tissue. You're dissecting the IT band, you're screwing it into the lateral femur. And then there's a big incision. It's not like a tiny quad tendon graft incision. It's got some size to it so they can get full dissection. So, but I think that's painful. And a generalization that I've observed in talking to Kevin and Dr. Andrews and people like that over the years is lateral structural stuff causes more pain and swelling. Medial structural stuff causes more stiffness. So MCLs get stiff. Lateral IT band stuff gets more swollen. I don't know if it has to do with blood flow to the knee, arteries, lateral or whatever, or nerve bundles, but they tend to get more painful and more swollen with the old school lateral release, IT band, LETs versus that medial side where it's like an MPFL that gets stiff or an MCL that gets stiff. So just a generalization, little pearl for the audience.
Yeah, makes sense. I feel like anytime we add something to a procedure, the majority of people are probably going to be more cautious with it,
Yeah.
physical therapy wise, right? They're gonna want to go a little slower. They're gonna want to be more deliberate with it. And I don't know if that's the answer here, right? Like there's really no reason why we couldn't, right? Anything that's going to stress the LET also stresses the ACL and is already built into the protocol theoretically. So, I'll go back to what Lenny said, and like, you have more tissue involved, you have the potential for more swelling. That's a person I want to be more on top of in the early phases of the
Right.
rehab process because there's more trauma being done, more done to the joint that you just need to be really, really careful with. Um, the procedure makes sense to me though, right? I mean,
It
like,
does, and the research is kind of backing it up with decreased re-tear rate. So it's one of those things that we have in our back pocket to do for somebody, especially who already had one, and they're fearful they're going to re-tear again. And this seems to significantly help, which is encouraging.
yeah, yeah. I mean, I'm excited for it. I mean, I think we're going to start seeing it more and more with people, especially just being done almost like prospectively in the young female athlete or somebody that you think just might be, really, really tough. But again, like maybe this is why our ACL rates aren't as high as we want, right? Like maybe, it's kind of crazy to think that you have an injury you in the knee, you hurt one ligament, and everything else around the knee is magically fine, right? Like there's no capsular issues, there's no rotary issues, right? So it's almost like this is like, taking that, three-dimensional step. And, don't get me wrong, the ACL is, you could argue works three-dimensionally. Of course it does biomechanically, but it definitely works in one plane more than the others, right?
Right.
So, a capsular, I mean, this is pretty cool.
And keep in mind the ACL, the native ACL, is a two bundle ligament, and we only
Mm.
reconstruct one
Mm.
bundle. So we put it in an angle to try to capture that rotatory stability and the AP translation. But we're only putting one bundle in, and that's what Freddie Fu, who
Right.
out of Pittsburgh, tried to do that. And he did that with his surgeries, and I don't think the research screamed it was a game changer. And so it didn't really catch on with everybody. So it is, you're trying to reconstruct what the native is there, but it's not perfect. I will say, going back to the rehab portion, I would be cautious with doing some abduction type stuff. Like a sideline abduction, like the basic stuff we do early on. You just don't want to stress that lateral side too early. Remember, they did take a chunk of the IT band out, so like a weighted, heavy weighted, sideline hip abduction. I tend to be a little cautious with that. It's one of those, why stress it too much? It's already stressed from the surgery, so I would just be cautious with sideline abduction.
Yeah, and you can get some hip strengthening in other
Mm-hmm.
positions and other things too. But
Right, right.
IT band's huge. You don't need it all. It's
It
like
is right, right.
that's awesome, Lisa.
As one of us who doesn't really treat ACLs very often, I have a question. As the IT band like heals and over time, do you guys see it get like wicked sticky where that piece came out? Like what happens to the kind of like donor part that they pull from there?
Yeah, I haven't seen anything in my patients. It tends to heal pretty well, and I don't know if I've ever seen like a second. I don't know if anybody's ever doing like a second look or maybe an ultrasound to see. I imagine the tissue fills in with scar tissue or something like that, or it's just like the gap is big enough that they took that remains like that. So, but I haven't seen any issues like longer term or short term, midterm where there's an issue. So. There's probably going to be somebody out there that had that, but nothing that I've
Right.
seen. How about you, Kevin?
No, yeah, I would agree. I
Yeah.
hadn't really seen anything from like a mobility standpoint changing, but I remember Dan and I did a little review on the IT band, and it is a pretty important. It acts like a tendon when you're running, so I would imagine that some of that capacity is decreased, and the load has to go somewhere else. So I would think it's important to just in the rehab process continue to strengthen all the lower extremity tendons important in running and take a little load off the IT band. But I hadn't seen any mobility changes per se.
Right.
I would imagine all the things that we do already probably mitigate that, right? Our soft tissue work, our patellar mobility, our range of motion progression probably mitigates that too. So awesome. Well, I'm looking forward to seeing this, in 10 years. I don't want to see it in 1 year. I want to see it in 10 years and just see like how these outcomes have improved, because I think that's the key to this sort of thing, but pretty exciting. So great question, Joseph. Thanks for asking. If you have a question like that, head to mikereinold.com, click on that podcast link, and you can fill out the form to keep asking us questions. And please subscribe, Apple Podcasts, Spotify, so you get notifications, and we'll see you on the next episode.